Charter, Health 8, Module 3, Prevention and Control of Communicable Diseases and Agencies Responsible for Prevention and Control of Communicable Diseases. At the end of the discussion, the students are expected to know the prevention and control of communicable diseases, demonstrate self-monitoring skills to prevent communicable diseases, and identify the different agencies responsible for communicable disease prevention and control. Let's have a pre-test. Read each statement carefully and identify the correct answer. Write your answer in your activity notebook. Number 1. Diseases that are transmitted to one person to another. And the answer is communicable diseases. Number 2. An example of communicable diseases known as COVID-19. And the answer is letter C, coronavirus. Number 3. Which of the following is not a practice to prevent the spread of communicable diseases? And the answer is letter D, uncover your mouth while coughing. Number 4. What does WHO stands for? And the answer is World Health Organization. Number 5. Which of the following is the core function in the prevention and control of diseases? And the answer is letter A, investigate the outbreaks. Let's have a recap. The previous lesson discussed the nature of communicable diseases and some common communicable diseases. You have also learned the signs and symptoms that can give you an idea to be aware of your health and also to other people, including your family members. You have already known the misconceptions, myths, and the beliefs about the common communicable diseases. Let us proceed now on Lesson 1, Self-Monitoring Skills to Prevent Communicable Diseases. Healthy habits prevent germs and infectious diseases from spreading. Learn, practice, and teach healthy habits. Number 1. Handle and prepare food safely. 2. Wash hands often. 3. Clean and disinfect commonly used surfaces. 4. Cough and sneeze into a tissue or your sleeves. 5. Don't share personal items. 6. Get vaccinated. 7. Avoid touching wild animals. 8. Stay home when safe. Here are the do's and don'ts on how to help your community to stop the spread of communicable diseases. Do's. Wash your hands frequently. 2. Stay home and limit contact with others. 3. Clean frequently touch spaces in your home. 4. Seek medical help if you are suffering from a fever, cough, or difficulty breathing. Don'ts. Number 1. Don't go to crowded areas. 2. Don't touch your face. 3. Don't be in a close contact with others. Number 4. Don't ignore symptoms. And lastly, number 5. Don't leave your home, especially if sick. Now, let us proceed to Lesson 2, Prevention and Control of Communicable Diseases. The World Health Organization recommends some strategies for the prevention and control of communicable diseases. Communicable diseases are a major cause of suffering, disability, and death in the world. The World Health Organization's program on communicable diseases provides technical guidance and support to national governments to organize and implement programs aimed at setting up or strengthening ongoing control of communicable diseases, reducing transmissions, mortality, morbidity, and human suffering, and gradually eliminating these diseases so that they cease to be a public health problem. In some cases, The aim may also be eradicate selected communicable diseases. The core functions in the prevention and control of disease are 1. Setting priorities, 2. Detecting and reporting cases, 3. Investigate outbreaks, 4. Undertaking action, and 5. Assessing the result of action. Some prevention and control tasks. 1. Immunization, 2. Safe water supply and sanitation, 3. Food safety, 4. Injection, 5. Vector control. And there are 3 levels of preventing diseases. The primary prevention. These are done to prevent one from having the diseases. The following are the activities done to prevent getting sick: getting immunized, eating balanced diet, getting enough sleep, avoiding vices, preventing yourself from doing a lot of work that can cause sickness. The secondary prevention activities are done to prevent further damage when the diseases has already started. We have the prompt diagnosis. Visit a healthcare practitioner for a reliable information treatment. Take a prescribed medication given by a physician. The tertiary prevention. The focus is on rehabilitating the sick person so as to prevent long-term complications of the disease. Following up and monitoring the patients to ensure that he or she is taking the prescribed medication. Having physical therapy to restore the function in debilitating diseases. Undergo medical procedure to treat or cure the disease itself. Here an example on how to prevent the spread of communicable diseases using the 3 levels of prevention. Example of communicable diseases is the COVID-19 or the coronavirus. So here are the primary prevention, the secondary prevention, and the tertiary prevention. And now, let us proceed to Lesson 3. Agencies responsible for prevention and control of communicable diseases. Here are the following agencies. WHO means World Health Organization. DOH, Department of Health. FDA, Food and Drug Administration. FHSIS, Field Health Service Information System. And we have also FNRI, Food and Nutrition Research Institute. We have also DOST, Department of Science and Technology. RITM, Research Institute for Tropical Medicine. NNS, National Nutrition Survey. PHS, Philippine Health Statistics. PhilCat, Philippine Coalition Against Tuberculosis. NTP, National Tuberculosis Control Program. And we have also BHS, Barangay Health Station. And of course, the DepEd, Department of Education. We have also NCDPC, National Centers for Disease Control and Prevention. NEC, National Epidemiology Center. PCPCND, Philippine Coalition for the Prevention and Control of Non-Communicable Diseases. For your activity. Activity number 1. Fill in the blanks. Choose your answer inside the box. In the 3 levels of preventions, the first level is primary. The world leading health agency is WHO. Number 3. The third level of prevention is called tertiary. Number 4, the DOST stands for Department of Science and Technology. Number 5, one of the core functions in the prevention and control of disease is undertaking action. Activity number 2, true or false. Write true if the statement is correct and write the word false if the statement is not correct. Number 1, wearing face masks is one way to prevent the spread of virus. True. Number 2, social distancing is not necessary for everyone, even someone is infected of virus. False. Number 3, consulting to medical experts in a waste of time. False. Number 4, communicable diseases is a major cause of death worldwide. True. Number 5, secondary prevention activities are done to prevent further damage when the disease has already started. True. So let us proceed to wrap up. To end this lesson, answer the following questions listed below. Write your answer in your activity notebook. For the valuing, on your notebook, complete the sentences and justify your answer. Number 1. You're a single mom of 5 children and you found out that you are infected by coronavirus, but you need to provide the daily needs of your children. What will you do? Number 2. Make a slogan showing the prevention of communicable diseases. At last, for your post-test, choose the letter of the correct answer and write your answer in your notebook. Number 1. This is an activity of primary prevention. And the answer is letter C, undergo medical procedure. Number 2. The leading health agency in the Philippines. The answer is letter C, DOH. Number 3. What is the correct meaning of FDA? The answer is Food and Drugs Administration. Number 4. Which of the following is not a preventive measure of communicable diseases? The answer is hugging infected person. Lastly, number 5. Which of the following is not a core function in the prevention and control of diseases? The answer is letter C, just keep silent. Thank you for listening.